I appreciate this opportunity to talk to you about Face2Gene, the app that is provided by FDNA and that many of you already use in clinic. You are probably very familiar with the Deep Gestalt technology. Deep Gestalt is the algorithm that's currently run in Face2Gene. And in Face2Gene, you know you can take an image, a photograph of the patient in clinic. The algorithm then recognizes the photo as a face, places a number of landmarks over the face as shown here, and then analyzes predefined regions individually and in a series of steps as a composite. And this abstracted data from the facial photograph is then compared and matched to a number of rare syndromic conditions that the system has previously been trained on. So the output that you will see is a ranked list of syndromes, with the highest ranking syndrome being the one that's most similar to the facial features in the patient you are currently looking at. So that is what you are used to. This is how rare syndromes can be assessed using the Deep Gestalt technology in Face2Gene. And as you know, this information has been published. And this is a very powerful tool, but the Deep Gestalt technology has a few limitations. In particular, for every rare syndrome to be used, the system has to be trained on this rare syndrome. And for this training, a number of facial images from patients with the syndrome have to be available for the training. And that works well for relatively common syndromes, but it does not work for ultra-rare syndromes. So you did not always get the right match for your patients using this Deep Gestalt technology. In the past, we've been working on developing a new technology, and this technology is now becoming available. And that's what we really want to show you today. The new technology is referred to as GestaltMatcher. So that's the term for this new algorithm that's now available. And this new algorithm is able to compare your single image of your patient to other single images. So rather than comparing it to a group of syndromes, each syndrome with a group of images that previously have gone through training, here a single image can be compared to another single image. And I want to show you an example of how this can work. So these here are two patients, one of Italian, one of Norwegian ancestry, unrelated to each other. These patients had their facial features analyzed with Deep Gestalt, and a comparison for each of them was made to Hutchinson-Gilford progeria. And here on the right-hand side, you can see the composite of the two patients, the two probands, and Hutchinson-Gilford progeria. There's a lot of similarities. Each of the two patients, the probands, had mandibular hypoplasia. They had delayed dentition, supernumerary teeth, microcephaly, lipoatrophy, I think, can already be appreciated in these images a little bit. And there is a lot of overlap to progeria. However, neither of these probands showed a variant in LMNA, which is characteristic for progeria. In contrast, both individuals showed novel de novo variants in a newly identified disease gene called LEND2, as shown here. And functional studies have determined that this truly is the disease-causing variant in these patients. So as you can see at the bottom of the slide, this has now been published. In addition, using the GestaltMatcher algorithm, the two images of the probands were compared to each other and to 214 images from other individuals. And what you can see in this diagram here is, using this GestaltMatcher approach, that these two individuals match very, very closely based on their facial features. And I think you can easily appreciate that when you look at the photographs yourself, they are much more similar to each other than any of the other patients that were part of this analysis. So this shows the one-on-one comparison, 2 single images that match very closely. Let me show you now how you can use this in clinic yourself. So here's an example of a patient of mine. I took a photograph, and what we usually do is we look at the rare syndromes. That's the typical approach with deep Gestalt results. And you can look at this, but you might find that you don't have a good match, and then you could decide that you want to go on to use the new capabilities of Face2Gene. And this is something that you can do on your desktop, and you can see here the ultra rare and undiagnosed categories. So that's what you would do. You would look at the ultra rare or undiagnosed categories, and this is where the algorithm changes to GestaltMatcher. Let's first look at ultra rare. Ultra rare can be looked at as looking at syndrome categories. These are syndrome categories of patients that were molecularly diagnosed with this condition, but overall, there aren't enough patients in this category to really work for the Gestalt training that is used for the rare syndromes. So these are syndrome matches, and you can see here that you've chosen to look at syndrome matches, and here are suggestions of syndromes that match. If you change this particular button here to individual patients, then you will see individual patients that have a specific diagnosis. And you see here, this is the patient. My patient was previously published, and here is matching to an old image of herself from a publication. So here she matched to a patient with the same diagnosis. And you could see this here for other patients that have a specific diagnosis, and you could match things that way. If you wanted to look at this in a different graphical view, you can also choose to click this button, the process graphical view. This will give you an image showing a 2D representation, shown here, of a number of dots. Each dot represents a single patient, and the color of the dot represents the different conditions that these patients have been diagnosed with. So our patient here is a little gray dot, and you can compare here what other conditions are closely matching, or what single patients with what condition match most closely to your patient. This is a 2D representation of a multidimensional space, and Peter will explain in a little bit more detail the technology behind how these things are created. So lastly, if you've run through the ultra rare syndromes in patients and you have not found a good match, you might want to go to the next step, and this is truly undiagnosed patients. So here, your facial photograph would be matched to other patients that do not have a diagnosis. These are single patient images, and you have this bar here that gives you a rough estimation as to how similar your patient's facial features are to those that you're comparing them to. And you have some information about what the most striking features are of those patients. So if you were to identify a patient here that matches very closely and that has interesting features so that you want to learn more about this patient, you can choose to contact the clinician. And what happens when you press on that button is you have this pop-up screen where you can add your information and you can contact the clinician who submitted that image so that you can connect and talk about your cases amongst each other. So this is a capability that I view as very similar to GestaltMatcher, where you match an interest in a specific gene. Here you can match an interest on specific facial features. Now it's important, if for the future you want your patient to participate in this match so that somebody else could possibly match with your case and contact you, then you need to click this button here, match your patient. And you need to be prepared to receive emails of close matches of other clinicians trying to contact you about this patient. So this is something that the undiagnosed match could help you with. So as I said, I'm hoping that this new technology that's very powerful and that allows you to compare a single patient image to other single patient images rather than to previously trained syndromic categories is going to become very powerful. It's going to help you make potential diagnosis or consider differential diagnosis for your patients. And it will also be able to help you to identify novel conditions, as I've shown you on the example of the 2 programs with the LND2 variants. So my hope is that this truly works similar to GestaltMatcher as a tool where you can connect to other clinicians worldwide and identify rare patients that match each other. So thank you for listening, and I really appreciate your interest.